All right, I think I know most of you, and you might know me. I'm Lois Mayer. I've been here for a little over a year, and I am a PT. I worked in the clinic for many years, and I do know personally and professionally about knee pain. So, you think this lady is going to have knee pain in now or in 20 years? Later. And back problems, right? Because your body is connected. So just because the pain is in your knee doesn't mean that it's not going to affect something else like your back. All right, so what we're going to talk about today is the knee joint. We're going to talk about what it does, which is the functional anatomy of it. We're going to talk about the knee anatomy. You may know more about the knee than you ever wished you did by the time we're done. We're going to talk about common knee injuries. There's lots of structures in there, and any of them can get hurt by themselves or in combination with others. And then the consequences of knee injuries. So what happens when you're a kid and you're playing and you're messing around on the farm or playing or bike riding or whatever? Dancing can affect how your knees work later. And then we're going to look at some treatments, both non-surgical, which includes physical therapy, exercise like we do here at St. Clair, and then sometimes it's surgery. So we're going to talk a little bit about surgery and what to do about that. And then I have some resources on the presentation, some resources on the handout. But if you ever have questions, you can ask me, and I'll see if I can find the answer. All right, so why are we talking about knee pain? The NIH, with all its wisdom, says 25% of adults have frequent knee pain. You think it's 25%? More. And surprise, it's common in people over 50, and it's especially common in people over 65. Would we agree with those two? Yep. Yep, okay. But they still look happy exercising. This guy too. Okay, so what are the contributing factors to knee pain in seniors? Because that's where we are. Part of it is because we have less muscle mass and strength. Our greatest strength in our muscles is when we're 25, when we think we're invincible. Wow. By 65, you can lose 25 to 40% of that strength. Does anybody feel that? Yep. I feel that. I was talking to a high school coach and said, she's 65 now. She says, I feel weak. And this is somebody who's worked out forever. And she feels the difference between now and then. If you're carrying extra weight around, that puts a lot of extra pressure on your knee. So ideal body weight is a range that has been determined is ideal for your body height. It doesn't matter what age you are, it's kind of a height thing. And for every pound you weigh over that ideal body weight, it's an additional 4 pounds of pressure on your knees, which is why one of the first things that you hear when your knees hurt, if you're overweight, is lose weight and see if that helps. So, for example, if you're 15 pounds over ideal body weight, that's an extra 60 pounds of pressure on your knees. And that's just when you're standing and walking. If you're active and running, it's even higher than that, because when you run, there's an extra 30% amount of pressure on your knees. And arthritis, which I'm pretty sure most of us feel like we have. So functionally, what does the knee do? It supports your weight when you're standing up. It helps you lower and raise your body, so sitting, standing, squatting, which is why, if you're doing exercise classes at St. Clair, we do the dreaded sit-to-stands for 30 seconds, right? It allows rotation and twisting of the leg to position your foot correctly when you're walking. It makes walking more efficient. It's a lot more efficient if you can bend your knee and swing it forward and then shift your weight and step, rather than doing a monster stomp, right? That's a lot of pressure on your knee. It's a lot of effort for your body. And it works with the ankle to help move the body forward, especially if you're running. It provides stability and proprioception. Proprioception is where your body is in space. It helps your body know where it is. So, and it acts as a shock absorber. And there's special tissues in the knee joint to help with the shock absorption. So that is what your knee looks like. Isn't it pretty? So it's got bones, it's got ligaments to hold in the knees, the bones where they're supposed to be. It's got meniscus in there to cushion the shock. And it's the femur bone at the top, your thigh bone, and then there's two bones in your shin. The big one's the tibia and the little one's the fibula. And then the patella, the kneecap, it's in there too. So the knee joint is a synovial joint, which means there's a sac of fluid in there that lubricates your knee joint, just like oil lubricates the engine of a car. And it helps your knee move into flexion and extension with a little bit of rotation. And it consists of two joints, the tibiofemoral and the patellofemoral. So let's see if this will work. So here's your femur. Down here is where it's touching the tibia, and the patella, the knee, kneecap, goes against the femur. So we'll review. There's four bones, the femur, the tibia, the fibula, and the patella or the kneecap. And that's a triangular bone that actually sits in a muscle, the quadriceps. Little bit of trivia, little babies are not born with a patella. Once they start crawling around, it develops. And then the knee joint is lined with cartilage because the forces going through it can be massive, 3.5 times your body weight when you're going down the stairs. And kneecap pain is very common. So the cartilage is located between the femur and the shin bone, the tibia, and behind the patella. It's there to absorb the shock of movement. Its function is to absorb shock, to reduce the forces going through the bones, reduces friction, and allows the bones to move more smoothly. So when all those bony surfaces are smooth, they move a lot easier. If there's little nooks and crannies, an extra bone in there, like when you've got arthritis, it doesn't move so easy. It gets stuck, it gets locked, and it just plain hurts, okay? And usually as you age, the cartilage thins out, and it isn't able to do its job quite as well. So there's two types of cartilage, the articular cartilage, which is a thin layer between the joint, the knee meniscus, which is thicker, and it sits on top of the shin bone, but it's thickest at the patella because of all the forces that go through the kneecap to help you move. All right, so we talked about the bones. We're going to move on to the muscles. The muscles most people think about is the quadriceps, the ones on the top of your thigh. They extend the knee, they straighten the knee. So when you're sitting down in class and you're straightening your knee, you're strengthening your quads. When you're doing squats, dreaded sit-to-stands, quads. Hamstrings bend the knee. So when you're doing all those butt kicks in class, you're working on the hamstrings. The glutes control the knee position and how the forces go through the knee. So if you have knee pain, chances are when you're doing exercises, besides working directly with the muscles at the knee, you're going to work the muscles in your hips and your butt. Strong butt, strong hips helps with knee pain. And the last set of muscles that have something to do with your knee directly is the calf muscles, the muscles behind your shin. And weakness and tightness in these muscles can cause knee pain. And here's a pretty picture. So the quadriceps straighten the knee. They help bend the hip. There's 4 distinct muscles that make up the quadriceps. They help keep the kneecap stable. So if you feel like your kneecap is wobbling around a little bit when you're moving, doing some quadriceps exercise might help with that. When you're walking, it absorbs forces when your heel hits the floor and helps stabilize your knee, your leg. The hamstrings are in the back of your leg. There's 3 muscles there. They're going to bend your knee. When you're standing on one leg, the hamstrings help bring the leg back behind you and give some stability to the knee and controlling the motion of the lower leg. Butt kicks are important. The glute muscles help strong glutes help prevent knee injury. They help your hip and move to the back and the side. They stabilize your hips and pelvis, help with balance and walking. Another big reason to work on your glutes. And they help support the low back when you're lifting. Calf muscles, the fancy name is the gastrocnemius. There's 2 parts to it. It works with the hamstrings to bend the knee. It stabilizes the posterior knee when you're walking or running. It helps with the push-off and the burst of power when you're running or going uphill. And the muscle that helps you do the tiptoe walk. And soleus is a little muscle. It doesn't get a lot of attention. It's underneath the gastroc. But what's important about it is it helps point your toes when you're walking, and it helps pump blood from the lower legs back to the heart. All right, so along with all the muscles, the ligaments are involved in the knee to help stabilize it. So the muscles help stabilize and move it. The ligaments are there to keep it in place. So it's tough, fibrous connective tissue which attaches bone to bone. So the ligaments are going to hold the femur and the tibia, or the femur and the fibula together. And you can see them right in here. So there's a big one on the side, there's a big one in the front. So when people, lots of times it's an athletic injury, they've torn their ACL, which is a lot of rehab. A lot of football players get it. Anytime you're planting and twisting, that tends to aggravate the ACL. There it is. And its function is to provide stability to the knee joint. And then there's ligaments on the side, the cruciate ligaments, that prevent too much forward, backward, or twisting movements, and the collateral, the cruciates in the front, the collateral are on the side, too much sideways movement. Isn't that a pretty picture? They have such great pictures on the internet. So the symptoms for a torn ligament: pain and inability to walk. 2 of the big, or 3 of the big ones are significant swelling. Sometimes when you get your initial injury, they can't do an MRI or an X-ray because your knee blows up so much. You might feel a pop. You might have instability or feeling that the knee's not strong, and your knee can give way. The unhappy triad is when you plant and twist inward, and you can affect the ACL, the MCL, and the meniscus. So there's lots of things. The knee is a small joint, and there's all these structures that are in there. So when you injure one and there's a lot of swelling, it's probably going to contribute to a lot of irritating a lot of other structures too. All right, so the ligaments attach bone to bone, the tendons attach muscle to bone, and that's what will swell when you have some overuse. The common one is the patella tendon. When you're doing a lot of lifting and carrying things, too many sit to stands, like way too many sit-to-stands, way too many squats. Okay, and the patellar tendon, there it is, attaches the quadricep muscles to the shin bone. Then the kneecap actually sits in the patellar tendon. Anybody tired of anatomy yet? We're almost done. So the symptoms of the knee tendon injury are going to be very similar to the ligament, pain and tenderness. This in particular, if it's the patellar tendon, it's going to be irritated right by the kneecap. Swelling, pain with walking, running, or jumping, pain with bending and straightening your leg, tenderness in the lower part of your kneecap. The other name for patellar tendonitis is jumper's knee. So you can see that when you go to the doctor and say, hey, my knee hurts, and they say, well, where does it hurt? And they kind of poke around and irritate it and get you aggravated because they're making you feel worse. It's because they're trying to determine what structures may be affected and which ones are just a symptom that is because of all the irritation. There's also something called bursa. Everybody hear about bursitis? So your knee has lots of structures to help it move easier and to try to minimize the irritation. So you have the cartilage between the joint, and you've got bursa, which are little sacs of fluid to help reduce the friction between the bones and the soft tissue, the bones and the muscles, to prevent inflammation. Sometimes that doesn't help, and they swell up, they get irritated. A lot of overuse. If you used to crawl around on your hands and knees to wash your floor like my mom does, right? You can irritate a bursa. And there's 5 main bursas that you can irritate. So excessive friction on the bursa, usually from muscle weakness, tightness, or repetitive pressure, can inflame the bursa and get you bursitis. So here's a picture of a nice healthy bursa, nice and blue and calm, and over here it's irritated and swollen and inflamed. Symptoms of bursitis, guess what? Pain, swelling, tenderness, warmth around where it's irritated, redness, that's a new one, fever and chills, that's a new one. So when you're talking to the medical practitioner and they want to know what's going on and what's different now than before you started to have pain in your knee, they're looking for these kind of red flags, the things that make it different. And it can happen quickly if the knee gets hit, if you get whacked with a baseball bat, or if you fall on your knee, and it can happen quickly. It can also happen over time. All right, so also a protection for the knee is the joint capsule, and that surrounds the knee joint itself, and there's 2 layers. The outer layer is to provide stability to the joint by holding the bones in the correct position. And then the inner layer has the synovial fluid, which is like that oil, right, that lubrication to help keep the bones moving easily and not rubbing on each other. Lubricates the joint, helps reduce the friction and irritation of the bones, ligaments, and tendons when the knee joint moves. So the knee joint is designed with a lot of structures, but also some safety things. The bursa, the joint capsule, the synovial fluid, that's all designed to work easily and well together. And overall, the knee capsule allows the full knee motion of flexion, extension, bending, because the capsule will fold. Same kind of symptoms if something's irritated in the capsule. Sharp or achy pain, swelling, stiffness and locking, those are different. Cartilage too can get you some stiffness and locking. And decreased range of motion, doesn't move as well, and it's tender. Causes of knee injuries, the most common mechanism, what actually does the damage, is hyperextension of the knee when your knee slams back, injuring the posterior capsule, right? Turning outward. The knee joint is not supposed to move too far in either direction, in or out, in a rotation. It's just supposed to go forward and back with a little bit of sideways movement. Planting the foot and twisting the knee, overuse, and something directly hitting the knee, or a combination of all these things. How likely is re-injury? You got hurt as a kid several times. You fall now, and then your knee isn't doing quite what you want it to do, isn't working quite as well as it did before. So how likely are you to get hurt again? Well, it depends on what activities you're doing, how old you are, and the history of injury. If you got hurt as a kid and then your knee was doing okay, and now that you're getting older and you're trying to do simple things like walking and standing up from a chair, sitting down, all those things have influence the re-injury. Activities straining your knees, heavy lifting, repetitive squatting, running, prolonged standing. More common when you were younger, but still can do now. As you age, your structures just wear out. Things are just thin and aren't as strong anymore. Chronic knee injuries, chronic pain can affect your re-injury. And knee injuries can cause compensatory changes in your movement, how you move, how often you move, and what other body parts are going to help your knee to get you to move. Your body wants you to be able to do what you want to do, and so if your knee is not strong enough to do it, you may use extra movement in your hip, you may use extra movement in your trunk to get you to do what you want to do. So what happens later if you hurt your knee as a kid or in your teenage or college years? You can get arthritis, which is a gradual breakdown of the cartilage. Other things that can contribute to pain: genetics, previous knee injuries, repetitive stress on the joint. Symptoms, we've already talked about, just mild irritation to just can't do what you want to do, swelling and stiffness. And this doctor said there seems to be something about the moment the injury happens that causes bones to hit together and bruise, and that raises your risk for arthritis later on. Age-related knee changes, they're natural alterations in the knee joint as we get older. May cause discomfort, pain, and activity limitations. Knee pain is very common. It can affect walking, stair climbing, and activities of daily living. Standing up at the sink, brushing your teeth, standing up to cook, walking around outside, doing your gardening, doing your lawn care. Your bones change, so it's not just the soft tissues, the bones change and can contribute to fractures. The muscles, like we talked about before, they're just not as strong. There's not as much muscle either. The meniscus and the cartilage thin, and these age-related changes can contribute to falls, which is one thing we're really trying to avoid, right? All the exercises, all the activities we have here. My mom is now 100, and when she was in her early 90s, she fell at night in the bathroom, and that really slowed her down. Until then, she could sneak downstairs to do laundry. My brother would wonder where she was. She'd sneak outside, but after she broke her hip, she wasn't able to do that. So one of the goals that we have here at St. Clair's is to help you avoid falling and help you to avoid breaking a hip. Here's what arthritis looks like. Here's your healthy knee, nice and white and smooth. Here's your arthritic knee, kind of all jagged. Extra bones, little bone spurs down here, which are going to get in the way when you're trying to move. And here's another picture, less cartoonish, of the healthy knee, and then these little pittings in the bones on the arthritic knee. So tests for arthritis, x-rays is your first typical test. You see the loss of the joint cartilage, the narrowing of the joint space. Does that sound familiar? Anybody have this diagnosis? Bone spurs. They can also look at the fluid, the arthrocentesis. They can also go in there and do a surgery and see what's going on. It's a minor, arthroscopy is a minor outpatient surgery. They go in with the scope and they kind of trim up the structures that they can, the soft tissue that they can. Sometimes they're able to smooth out the joint a little bit. Regardless, eventually your knee pain may take you to the doctor or the PT. You may have, did I skip something? Nope. Possible treatments are strengthening and stretching exercises after minor injuries. Range of motion exercise help you move more through the joint range of motion. Home exercise program, pain management. Does that sound familiar?
Yes.
Yes. General treatments for knee pain. Initially, rest, ice, compression, elevation. Some easy exercises, moving into medication, pain management. There's some injections. Long term, work on weight management, eat whole foods, avoid processed foods. You've heard that from classes here at St. Clair too. Wear supportive shoes. Look down. Anybody wearing their stilettos? No way, man. Nope. That's for those young people. Yep, we're in our tennies. We're in our nice sandals with some good support. You may look into nutritional supports, glucosamine, chondroitin, calcium, vitamin D. Sometimes they go in for surgery. The arthroscopy is the easy one that they go in and do as an outpatient. Sometimes the knee bones are just need to be replaced. They're just worn out. Exercises. Focus on flexibility and strength. No surprise, that's what we do at St. Clair. Look, we have yoga. They have water aerobics at Patterson and SportsCom. Biking, walking, and balance. All those things should sound familiar to you. Google has all kinds of exercises. And those are some of the sites. There's other ones listed on your handout. We're going to do a little bit of exercise, gang, if you would like to do some. Okay. We're going to do some quad sets. Quad sets is where you tighten your thigh muscles. So when you go to straighten your knee when you're sitting, your quads fire to do that. So if you just want to do a quad set, you're not going to move your knee. You're just going to tighten your thigh muscles, and you're going to squeeze them tight. Okay? And then if you really want to effectively do straightening your knee from sitting, you're going to squeeze your quad tight and then lift straight out. So try that one. So think about, just go ahead and do kicking your knee out straight, okay? And just feel how that feels to your thigh if you're just kicking your knee out straight, okay? And then do it a couple times where you tighten the muscles in your thigh first and then straighten it out. And notice the difference that you feel in that muscle, how much harder your muscles are working if you're tightening it first and then straightening it out, okay? Some of these other exercises, the butt kicks, the bridge, those are working your butt muscles. The clamshell, You can do that when you're sitting too, one leg at a time, just by stepping out to the side and coming back in. That's a real common exercise in sitting. Side stepping, lots of that done in the exercises here. Lots of it in Zumba, if anybody's taken Tina's classes, lots and lots of those. Squats. When you're squatting, remember to stick your booty out, and the weight is on your heels when you're doing a squat. Planks, even I don't like to do planks. They're hard. They use practically every muscle in your body, but you can work your way up to doing one on the floor. Okay, so you can push against the wall and hold yourself up. You can hold yourself up on a table. And we've all done this when we're talking to somebody or kind of stretching. This is considered a plank. And you can make it harder by lifting your arm up. Okay, you can make it harder by lifting and turning. But you don't have to do it on the floor. That's a progression, okay? Okay, so perfect. How about that? What exercises do you do and when do you stop? Well, you stop when you have knee pain. If your knee hurts and you're trying to get it better, avoid doing something that makes it worse. There's a difference between my muscle is sore and by making my muscle do work, it irritates my joint. Okay, because if your knee is irritated, there's probably swelling in there. And you saw how little that joint is. There's not a lot of extra space in there for swelling and for movement. So if there's swelling, one of the reasons you don't move as well is there's just not room for the bones to move. So if it's not an acute injury, you want to look at when the pain happens and how long it happens. So really, you should be doing minimum moderate intensity is what most of us are doing. St. Clair exercises are in that range. If you do exercises and you're really, really sore a couple of days later, it might be okay if it's in the muscle, because those muscles have worked, and usually after you do an activity, it takes a couple days for the muscles to really get sore. If it's a week later and you're just as sore as you were, that's too much. A lot of people like the classes we teach here, and they'll do 2 or 3 classes in a row and then they get wiped out for a few days. Probably too much. Take a couple classes, give yourself a break in between them, maybe 1 in the morning, 1 in the afternoon, 3 in a row. By the time you're in that 3rd class, those muscles are tired. So maybe alternate which classes that you're going to. Give yourself a break. Our muscles just can't handle a lot of activity anymore. Don't push through the exercise through pain, because that means that you're probably going to make the cause of the discomfort worse. If there's irritation in the knee joint and you're doing lots of sit to stands, you're doing lots of stair climbing, you're doing lots of even the walking classes, right? If that makes it worse, take a break. Most importantly, find something that you can do safely and comfortably. If walking 30 minutes is too much, break it up into 3 10-minute walks and try to increase that over time. Sometimes you end up with knee surgery. Exercises didn't do it. Resting didn't do it. There's something actually wrong that needs to be fixed. So surgery could be the arthroscopy, it could be a replacement. Before you have the surgery, especially the knee replacements, the doctors will probably talk to you about weight loss, exercise, quit smoking. Post-op, you're doing exercises and adjusting your lifestyle to include activities, watch what you're eating, pain management. If you have questions on any of that, ask us. There's lots of classes at St. Clair that deal with all those things. And the expected outcomes, you want to decrease your pain, increase your mobility, and do what you want. Nobody wants to live with pain. You want to do what you want to do without pain. So that's our expected outcome. The resources, those videos are on your handout. The pictures came from stock computers and then some studies and more resources. Thank you for listening. Thank you for coming.